I'm honored here. I'm sitting in the Sheraton Hotel in Los Angeles, California, and I'm honored to be able to speak with Dr. Sunil Pai tonight. Thank you for being with us.
Oh, thank you for inviting me.
And I'm really curious to get your take on several of these natural cancer treatments that I've been studying and researching for years. And I saw you give a lecture earlier today, and you included all of them. So first of all, share with our viewing audience how you got involved with medicine, with natural cancer treatments, with integrative medicine.
Okay. So my background, I'm an MD, so I'm conventionally trained in family medicine, but I did a fellowship with Andrew Weil 14 years ago in integrative medicine. But further than that, I then went to India and studied a little bit more of Ayurvedic medicine. Ayurvedic medicine is the traditional medicine of India that dates back almost 5,000 years. And many of the things that I spoke about in my lecture today is rooted in that old history of what we use food as medicine. So although people think of Hippocrates saying, you know, let medicine be thy food and food be thy medicine, it goes further than back.
So he snagged it from someone else.
Everybody thinks that the history started with the Greeks and Romans. There's a lot more history than that, right?
Sure.
Depending on what school you went to. So we look at a variety of things, and one of the main ingredients or natural therapies that has been very effective, and now that we have a preponderance of data in terms of clinical efficacy, in terms of cell culture, animal studies, and now in human clinical trials, is many of the ingredients I spoke about today, such as curcumin. Curcumin is an ingredient that comes from turmeric. And turmeric is a root. Okay, we use it in cooking. So we think of curry.
Yeah.
It's a spice, but it's not spicy. So a lot of people have a misperception that it's spices or something. No, it's a spice, but it's not spicy. It doesn't have the heat component, like a chili, for example. But we use it in like yellow curry. If you went to a Thai restaurant, that's or people have mustard. What makes it yellow is turmeric powder. Okay. So unfortunately, in American cooking, it's used as a colorant, because it does have that yellow color. Yeah. It's a natural colorant, but it has a variety of other benefits. And one of the benefits is that it's a strong anti-inflammatory. And it now has been shown to block over 97 different mechanisms of inflammation. And so eating it as a food or even taking it as a supplement has a variety of benefits. And we can see a lot of data showing the support and use of why we have using this historically in our past, and also now what we use now in clinical trials as a supplement, and many companies now are looking at how to do it pharmaceutically as well.
Yeah, yeah. Now, so you talked about reduces inflammation.
Yes.
Inflammation linked to cancer.
Right.
So anti-cancer effects from...
And most of the data right now, there's 5,000 published studies on the benefits of curcuminoids. Okay. But now in the last 10 years, there's a lot of data now on how that affects cancer cell growth. And through these mechanisms of inflammation, like NF-κB, which I talked about today, one of the major switches of the immune system, COX enzymes, LOX enzymes. These are things that we take certain drugs like, say, ibuprofen, Motrin, Advil, Celebrex. But the nice thing is with the curcumin is that we have no GI, kidney, or liver side effects. So we can take this in higher doses or lower doses, and even, I didn't mention it today, but I forgot to mention that India, for example, has the lowest dementia rates in the world. And one of the issues that we're looking at, well, why? As a culture, and it's not that they're smarter people, is that we're finding out that they consume about 25 to 50 milligrams of turmeric daily over their lifetime, and that prevents inflammation in the brain.
Wow. So that's very interesting. Now, one of the things that I heard you say earlier in your lecture was that the gold, frankincense, and myrrh in the Bible, the gold could have been turmeric?
From what we're looking at historically, the gold may be referenced as turmeric. Turmeric, or curcumin, specifically the part of the turmeric, but turmeric was sold and cost more than gold at the time. This is during the spice trade, or the trade route.
Sure. And
it was always nicknamed the golden spice, we'd say. And so there's a lot of reference that the myrrh, myrrh is Google, which is not the website, but the Guggul. It's some people hear of Google lipid as a product or products out there. Google is an Ayurvedic herb, has anti-inflammatory effects and cardiovascular benefits, like lowering cholesterol. And then finally frankincense, which is Boswellia. So the three main herbs that were brought, the gift to the Magi, came from wise men.
That makes sense.
Very wise men.
I've never heard that before,
Right.
But that does make sense.
Right.
Because before, I always thought, okay, frankincense, myrrh, a couple of spices or
Right.
natural substances, and then gold
Right.
didn't really
Didn't
match.
didn't make any sense. Right.
Fascinating.
Right.
So you talked about Boswellia today
Right.
as well.
Right.
Can you go into a few of the mechanisms of action for Boswellia,
Yeah.
the way that it might reduce inflammation?
Sure. So Boswellia is also blocks NF-kappa beta. It's also a 5-LOX enzyme. So there's two main pathways in the arachidonic acid pathway in terms of when we get omega-6s from our diet, which I talked about. You know, we should be eating a plant-based protein diet, meaning less animal protein as possible and less highly refined oils, right? But too much of those trigger more inflammation, and then end up people taking pills that are blocking inflammation. Boswellia does that naturally on one of the main pathways called 5-LOX. It also has certain blocking aspects of what we call VEGF. These are vascular endothelial growth factors for cancer cells to grow, and also blocks a variety of transcription factors and enzyme processes. And the nice thing is that's also been tested in many tissues. Breast, bone, brain, for example, is one of the areas that we study a lot, where brain tumors like glioblastomas have been shown to actually shrink. And we have a handful of patients now that are the longest surviving glioblastoma recurrent patients in one of the big hospitals in New York State. Of your state history.
Yeah. I'm sure I know which one.
Yeah, we all know.
Yes. And that's with Boswellia.
Boswellia.
Okay, awesome.
Right.
Question for you.
Mm-hmm.
What do you think, so you talked today about a lot of natural things.
Right.
What's your take on what I call the big three, the surgery, chemo, and radiation for treating cancer? Do you ever integrate those, or do you try to stay away from them?
As an integrative physician, right, as an MD, my job is to offer all the opportunities and options. And so, unfortunately, you know, many people go conventional. It may be my personal option that I wouldn't if I was them, but I still have to present them with their options, you know, depending on their social economics, whether they have insurance or not. Unfortunately, a lot of people today are going to opt for conventional because it's covered.
Yeah.
Right? And I heard a lot of people today, I had to get my chemotherapy because it was covered. And I'd rather go to this clinic, say, here in Mexico or in California, but I can't afford it, right? As an integrative physician, what I'd look at is how to improve outcomes. So to me, I present all the data, and I look at whether you go conventional, whether you go alternative, or for me, as an integrative physician, we're trying to look at the best of everything. I always look at how can we always improve the outcome? How do we take a toxic therapy and make it more targeted and less side effects?
So you say toxic therapy more targeted, like IPTLD.
Yeah, even then, you know, even now, it's like, for example, even though IPT has a lot of benefits, right, we're still giving chemo, even at a low dose. And so now there's certain clinics and certain people who are saying, well, maybe that's even, you know, that 1/10 is 1/10 too much. Is it better than 90% that most? Absolutely, right? And now we have the studies, which I showed today, and further data we'll have, but almost all the 13 or 14 major chemotherapy agents that is used in all cancers, with the animal studies and the human studies, will show that they always do better with those other products, like curcumin. So if people go for conventional therapy, or even doing IPT, we still should be using these other therapies to help, again, lower the toxicity and then kind of sensitize the tumor to those targeted effects.
What other treatments do you typically use for cancer patients? So we've got the Boswellia, the frankincense, we've got the curcumin, we got the high CBD hemp oil.
Right. And then I also use ginger and also black pepper. And so when we put those in combination, ginger's also, not only, most people think of it just for nausea,
right,
you know, or vomiting. And actually, the ginger has also been shown to block, you know, NF-kappa beta, LOX enzymes, COX enzymes, and it has a synergistic effect with the curcumin and the Boswellia. So in Ayurvedic medicine, we have formulas. And, you know, when I was conventionally trained, you know, we were always thinking of a single magic bullet effect, and we just gave one product at high doses. And when we look at traditional cultures like Ayurvedic medicine or Chinese medicine, they have formulas, and the reason is there's a word called synergy. And that means that when we use different ingredients, they work together to have a larger beneficial effect. And also sometimes they can even mitigate certain side effects even of each other.
The synergy.
It's the synergy. And it's hard because, you know, it's like putting multiple drugs in one thing, but when we use it as food or spices, we never just use one spice in a meal. We're putting multiple things. And the fourth ingredient is black pepper. And we use something called piperine or bioprine is the patented form of that. And that absorbs your product 30 to 60% better. So when we put pepper on our food, it's not only an anti-cancer, it blocks NF-kappa beta and LOX enzymes as well. It's also an antioxidant and also helps bioavailable enhance the digestion.
So that's why a lot of times I've seen people mix in black pepper with other ingredients because it helps all of them become
Right.
more bioavailable to your system.
And traditionally, in every Ayurvedic formula, we'd always put that in.
Black pepper.
Right? But also, every meal at every restaurant you go tonight, we'll go home and we're going to have something, we're going to crush some pepper. It's to improve that absorption to the body.
I've always done it just because I like the taste,
I love
but
the
I
taste.
guess I was doing a good thing and didn't
a good
know
thing,
it.
right? It's a very good thing. And so what happens, we've done something with Synergistically, is we put the curcumin at the right dose, the right potency, the Boswellia, and there's 3 fractions of Boswellia. There's something called boswellic acids, there's something called AKBBA, and there's something called polysol. And we've been able to find those fractions that are the most, we call it synergistic, and then put that together with the ginger at the highest amount of gingerols and the black pepper in a bilayered sustained release caplet. So it has a 20-minute onset of action and an 8-hour sustained release.
Wow.
Yeah. It's pretty amazing because, it's hard, it's taken us about 6 years working with the manufacturer in the animal studies, cell culture studies, and then even in the human clinical trials, because we're taking natural food products, and now I'm trying to blend the ancient wisdom of Ayurvedic medicine and the kind of modern convenience of pharmacology and say, how can we now manufacture this? So most of us are busy all day long. We don't want to take a powder that has a pungency or bitterness or it stinks or I've never eaten this. We want to take a pill once, twice a day and be done with it. And so it's kind of blending that, integrating that science, because we don't take teas and tinctures that we should in our culture. We want bubblegum flavored everything.
Right.
Right? And quick fix. I want to take something that lasts all day long. Take 2 in the morning, take 2 in the evening, all day long. So now we've been able to mix that science with wisdom and make certain products like Boswellia SR is what we have.
So it sounds like you're getting close to a silver bullet, but not really the silver bullet. You're getting a product that people can take and get all that they need in single products.
Right. And I mentioned before, it's not the silver bullet approach, it's looking at the sprinkler system approach, right? So like they're using a fire hose with a prescription drug and it can have side effects if you're right or left off of the target. We like to turn the whole sprinkler on so it's calming all the inflammation down. So hundreds of pathways of inflammation is being calmed. Now, the nice thing about these kind of products is that they can take it for prevention, they can take it for intervention, and they can take it for acute treatment. So it is dose dependent. So if someone's got a migraine headache, they take, bam, a few more right now. Someone has a cancer, they're taking a little bit more frequently so I can get a 24-hour effect. But just for prevention, they can just take 1 to 8 hours of lowering inflammation is a great thing.
Yeah, lowering inflammation.
Right.
Last question for you, Dr. Pai. One of the common threads that I've gotten from many of the interviewees is the importance of the immune system.
Right.
So these products that you've talked about, these natural substances, the Boswellia, the curcumin, and so forth, the CBD, what kind of effect do they typically have on the immune system, and is that really important?
That's super important. With all our patients, whether it's cancer or any kind of chronic disease, it's always about lowering inflammation and improving and increasing immune system response. Because your immune system has to fight, fix, and repair against anything, right? So it's not just suppression, it's about strengthening. But the nice thing about the natural therapies is it turns on and off genes accordingly. So it's not just turning off genes always. It's also upregulation and downregulation. So curcumin, I mentioned, I showed you that slide today, and it shows certain genes are now turned on that our body already has this natural mechanism of fighting cancer, for example. And we want to keep stimulating that. What happens is as we get older, through other things of environment, lifestyle, stress, diet, those genes and those transcription factors and those proteins turn off. So we all are born with it. We just want to keep stimulating it. Right? And the nice thing is that these natural therapies can, turn on the things that we want to turn on and turn off the things we want to turn off.
And they don't make you sick.
They don't make you sick.
Great information. Dr. Pai, thank you so much for joining us tonight.
Oh, thank you very much.
Really appreciate it.
Thank you.